Hello, everybody. I'm Dr. Rafich here for Vet Triage. It's September 17th, Tuesday, 10:56 a.m. Pacific time. And you're back for our live stream. Thanks for those in the playback who support the channel, subscribe, donate, all that stuff. Thank you. Let's talk about addiction in animals. Is it a thing? How concerned should we be? What do we do about it? So the medications that we often use that are associated with addiction are typically the narcotics. So, for example, opioids are one class of narcotics, and opioids are commonly used in the veterinary field, nowhere near as much as we see them being used on the human side. But most notably, some medications that are given orally, so given at home, like tramadol, for example, is a controlled substance. It's a weak morphine derivative. But there's lots of injections that we give in the hospital, buprenorphine, hydromorphone, et cetera, that are opioids, and obviously they're controlled substances. And then there are other controlled substances that are not necessarily associated with addiction per se, like diazepam, which is Valium, or something like gabapentin, which is not in the U.S. It's not considered controlled in every state. There are some states that don't consider it controlled. Others are labeling it as being monitored. But anyway, it is becoming more of a problem, I guess, on the human side with addiction, or at least abuse with gabapentin. But regardless, the class of opioids, narcotics, are used very commonly in both animal medicine and in human medicine. So it's an important thing to consider addiction, because obviously with the opioid crisis, we're well aware that human beings' lives are destroyed when they are reliant on these substances and become addicted to it. So, and then of course there are other addictive substances that human beings get entrapped with, a whole bunch of illegal drugs, or legal drugs like cigarettes, nicotine. But lots of illegal drugs too are possibly addicting, or if they're not, and in human society, they may be like the gateway drug to whatever, or multiple drugs being used at once is for recreational purposes is commonplace, and all that stuff. So the problem is much more diffuse and devastating in humans than it is in animals, and you never really hear reports of dogs or cats or whatever being afflicted by opioid abuse and addiction. And that's because we don't really recognize addiction in animals. And it's maybe because they can't speak. Maybe there are pets out there that have become reliant, and we just don't recognize the symptoms of that. Maybe the symptoms they are showing, we associate with them just being like happy, energetic dogs or cats. But or it may be that their mental complexity is not that of people, and so they just run differently. But in short, we don't recognize addiction in animals. We don't see that as being a thing. Now, can your pet be reliant on drugs? Well, sure. If you have a pet with a chronic condition, whether it be arthritis and they're on chronic anti-inflammatories and analgesics, whether your pet has cancer and is on a chronic dose of steroids, prednisone. If your dog or cat has an inflammatory bowel disease and they're on medications for that, lifelong, or other immune diseases, whatever. But yes, they can be reliant on drugs for sure, but that's not the same as addiction, which is an unhealthy attachment to a substance, and that usually to the detriment of their overall well-being. So we don't really recognize addiction in animals. They can have side effects from opioids. So, for example, slowing of the gastrointestinal tract resulting in constipation, bloating, things like that are commonly reported in people. And we can see that in animals. Another example is urinary retention. So the inability to pee normally is also something you can see in animals. And but again, these are just side effects. These wouldn't be considered like the body's reliance on them necessarily. So we just don't see addiction in animals the same way we do in people. Sarah Helms asks, are there drugs that humans use recreationally but have a different physiologic impact on animals? For sure. So a common one, for example, is caffeine. Caffeine is considered a drug, and people consume caffeine on a regular basis, and most people can handle it. Some people can't. But in animals, we consider it a toxic substance their cardiovascular system reacts much more profoundly to the effects of caffeine than human beings. Same thing that goes with with nicotine, for example. Again, it's hard to gauge that because we don't use nicotinic substances anymore in animals like we did back in the day for anesthetic purposes or whatever. But the physiological effects of nicotine are profound in animals. But I can't compare that. I don't know the answer to that compared to how much nicotine is in cigarettes, for example. We definitely see the toxicities when it comes to THC, marijuana products in animals, and the effects are profound because typically the animals don't have a sense of appropriate dosing. So they always overdo it and get insanely high and messed up from it. It's hard to be lethal, but it's concerning for pet owners who see those symptoms. And but also in people, when you take a substance like marijuana, you are expecting certain results, whereas dogs who get into marijuana are not expecting. They didn't take it on purpose to get a high. They just smelled something that was weird smelling and they were curious and they ingested it. And so when they go through this whole high phase, they're surprised by what they're feeling. Whereas in people, you kind of know what you're getting yourself into, right? For the most part. So those are some drugs that hopefully answer your question. And she also asks, I heard that dolphins get high off of pufferfish, but it's toxic for humans. Is there an equivalent for dogs and cats? Yeah. I mean, the caffeine is a good example of that. There are other substances that are not considered controlled substances or opioids that are in that category. For example, xylitol, which is an artificial sweetener that we see in a lot of human products like gum, for example, sugar-free gum, very toxic for animals and not toxic for people. So there are substances that have really different effects. Lots of things, grapes and raisins and onions and garlic. These are all things that can be considered toxic. But as far as opioids go, I don't really see a lot of that. But people use a lot of different opioids that we don't even use in veterinary medicine. So who knows what the effects of those are and whether we'll use them in the future. And Sarah Helms also asks, like catnip. What causes cats to get high from catnip? I have no idea. I've never done the research on it. I don't know if there is research on that. I have to look into it and see. It is really weird that cats get so crazy over catnip. So I don't know the answer to it. I don't know if there's a dog equivalent for that either. So good question. I don't know what's in there that makes it so appealing to cats. And I don't know whether there's other smelly things like incense, for example. Does that affect cats? Certain air fresheners or whatever. So I don't know what causes the issue, not the issue, but the effects that we desire from catnip and cats. But good question. I'm not really sure. Yeah. So that's how we think of addiction in animals. It's not really a thing that we recognize. It may be to our own ignorance, or maybe that animals just are wired differently. Maybe they don't have the complexity in their mind. Maybe they don't show the same symptoms. Maybe they just get over it. I don't know, but we don't really notice it as much. And so for those of you who have pets that are on chronic analgesia for whatever reason, don't feel like you're creating a drug addict for your pet. That's not what we typically see. So hopefully that helps. Thank you so much, Sarah Helms, for joining the conversation. Thanks for those who are watching the playback. I'll see you guys tomorrow and for another live stream. Take care. Bye-bye.